Hey, what is going on, everybody? I am Dr. Caban and welcome back to the channel. I am a board certified general surgeon and a fellowship trained bariatric surgeon in Ocala, Florida. Today I'm going to answer a very common question that I get. What do I need to do before bariatric surgery? In previous videos I helped you figure out if you qualify for surgery, and I went over several factors to help you figure out what bariatric surgery is right for you. So now that you know those two things, I am going to give you a list of things that you need to complete in order to go through weight loss surgery. Some of these things are required by most insurance companies in order to pay for surgery. So you need to call your insurance company to confirm your requirements. If you are self-paying for weight loss surgery, then the process is quicker and less extensive. You will have to ask your program what exactly you will need for self-pay patients. We have a bariatric coordinator in our office that will help you through this process. Francesca will help our patients with appointments, referrals, insurance issues or authorizations, and with any other questions that you might have regarding your bariatric surgery journey. Now please remember that this is for my practice. Other surgeons might have different requirements. For that reason, you need to contact your program and see what they require specifically. Okay, so the first thing that you will need is a psychological evaluation. This can be done by a psychiatrist or a psychologist. I have mentioned this before many times. Bariatric surgery is a big mental shift. You need to be mentally prepared for the big change. This evaluation is part of that mental change. Please take it seriously and take full advantage of this opportunity to talk to somebody about your issues and struggles with your weight. The second thing that you will need is a dietitian evaluation. If you can find a dietitian with bariatric surgery experience, that is just icing on the cake. Now, sugar-free cake or ketogenic cake, not regular cake. If you live in a remote area and you do not have easy access to a dietitian, consider using telehealth or any similar video conference service. Many dietitians will have this service for an affordable price. You might need to make a few phone calls, but you will find somebody that will get this done for you. You can certainly contact our dietitian. See the contact and the information in the description below. Long-term diet modifications are crucial for success after weight loss surgery. This evaluation with the dietitian is one of the most important things that you need to do before bariatric surgery. The third thing is the medically supervised weight loss program. Most of our patients will complete this with their primary care provider. You could also do this with some bariatric programs or through a certified dietitian. I don't routinely offer this service. I only do it for special circumstances. I am very busy doing surgery and I can't really dedicate a lot of my time to this aspect of your process, but you should not have much difficulty completing this requirement. Depending on your insurance, you will need between 3 to 6 months of a medically supervised program. For that reason, I will suggest that you get started with this today, this month, as soon as possible. This is the longest step. The sooner you get this done, the sooner you will have your surgery. The fourth requirement is to quit smoking. If you smoke, you need to quit for at least 3 months prior to surgery. I did a full video about why it is important to quit smoking before and after bariatric surgery. See the link on the description below. If you don't smoke, then don't worry about this step. But please do not start smoking after surgery because you can develop life-threatening complications. Okay, so before we continue, this is a very good time for you to hit the like button if you like the information in this video, or subscribe if you haven't. I really appreciate you helping my channel out. Alright, so let's go back to where we left off. Let's continue with the fifth requirement. You need an upper GI series or an upper endoscopy. An upper GI series is several x-rays that are taken while you drink some contrast, and an upper GI endoscopy is where a camera is placed through your mouth to look inside your stomach. This is done to evaluate your anatomy and to rule out any pathology that can affect your surgery in the esophagus or the stomach. Example of this can be a hiatal hernia that will have to be repaired at the time of surgery. Also, we can identify ulcers or cancer that should be treated instead of doing elective weight loss surgery. I will decide between one or the other, but you will need at least one of these two tests. If you are 45 years old or older and you are due for a colonoscopy, then you will also need to have one of these before surgery. In most instances, you can have the colonoscopy and the endoscopy done at the same time. Requirement number 6 is routine blood tests. Usually we will get vitamin levels, thyroid levels, and other basic blood tests. If you recently had some of this done, then there's no need to repeat those tests. We will give you an order to get this done at the time of your appointment with us. The next requirement is the pre-op bariatric class done by the hospital bariatric coordinator. This is mandatory in our program. It is very useful and important information. Many of the most common questions will be answered at this time. You will also get the booklet that will guide you through the post-op diet. This class is at no cost to you and it can be taken as many times as you need. By the way, we also offer post-op classes that you can take as many times as you would like for free. We also have a bariatric support group that meets the third Thursday of every month. Contact us for more details. See the information on the description below. The eighth requirement is do not gain weight. When you come to the office for the first time, you will be weight. I usually don't require weight loss prior to surgery, but I do mandate that you do not gain weight from that initial clinic visit weight. It is not fair to me or fair to you to gain weight prior to weight loss surgery. It is proven that patients that lose weight prior to bariatric surgery will actually do better in the long term. The more weight you lose before the surgery, the better. The thinner you are, the easier the surgery, the faster your recovery, and the quicker you will get to your goal weight. If you gain weight, your surgery will be postponed until you lose that weight that you gain. I have canceled surgeries for just a few pounds, so please do not gain weight. The next requirement is a sleep study. This is not mandatory for every patient. I do this selectively based on a questionnaire that you will fill out before the appointment. If you already have sleep apnea and use a CPAP, then the only thing that you need to worry about is to bring your CPAP machine with you to the hospital on the day of the surgery. Next up is the letter of recommendation from your primary care provider. The letter just has to say why you will benefit from surgery. This is separate from the referral to your surgeon. This letter is mainly for the health insurance company. We can provide you with a template that you can give to your primary care provider so he or she can use it to make the letter for you. The next requirement is the 2-week liquid diet. I did a full video where I give you 7 reasons why you need to do the liquid diet before bariatric surgery. I will place that link in the description below. Go and check it out because it gives you a lot of information of why you need to do this torture step. Finally, some patients might need an evaluation by a cardiologist, a pulmonologist, or other specialists. I get this based only on your individual clinical situation. This should cover most of the things that you will need before bariatric surgery. If you have any questions or comments, feel free to leave them on the comments below. Remember to hit the like button if you enjoyed this video and subscribe if you haven't. Thank you for watching and I'll see you on the next video.